Hello, everyone, and thank you for joining me here today. This will be a brief presentation about the 8 practice domains. In this presentation, I will be talking about the clinical evaluation, which is a systematic approach that helps us recognize and diagnose substance abuse problems and co-occurring mental disorders. There are two elements included in the clinical evaluation process, which are screening and assessment. In this presentation, I will be talking about screening. I will address the main points and the global criteria just to guide you in how to study for the LCDC exam, also known as the Substance Abuse Counselor Certification Exam by the IC&RC. What is screening? When we do a screening, we are distinguishing people who might have a disorder from those who do not have one. In other words, we are screening out cases. We are also reviewing the client's current situation. Basically, we are gathering general information. We are deciding if the client is eligible for admissions into a particular agency. And if the client is not eligible, then we need to make a referral. We are also considering the client's needs and characteristics. We are exploring the available resources in the community, and we are choosing the best course of action. How do we do a screening? We gather data using different screening instruments. This is not a comprehensive list, but you can see some examples of screening instruments used today. We have the Alcohol Use Disorders Identification Test, the CAGE Questionnaire, Drug Abuse Screening Test, Michigan Alcoholism Screening Test, and so on. How to select the right screening tool? We must select the ones that are sensitive to age, developmental level, culture, and gender. What kind of information are we gathering? The data we gather should include a general overview of current and past history of substance abuse or substance use, the types of treatment, physical and mental health, mental and functioning statuses, and the current socioeconomic and environmental problems. The screening is important because this is the first interaction between the client and the counselor. Our main goal here is to build rapport with our client. Competency is the ability to do something successfully and efficiently. The competencies for the screening process are to demonstrate effective verbal and nonverbal communication. Remember the uniqueness of each client. Understand the difference between use, abuse, dependence, and addiction. Know how to administer and score screening instruments. Identify validated screening instruments for substance abuse and mental status. Be familiar with symptoms of intoxication, withdrawal, and toxicity for all substances alone and in combination with others, and to know what a crisis is and how to prevent one. It is recommended to use motivational interviewing during the screening process. This is a very useful tool because it's effective at assessing the client's readiness to address substance abuse issues, and it is non-confrontational. It rolls with resistance, and it exposes the client's perception of the problem, measuring his or her stage of change. Clinical evaluation is related to four core functions: screening, intake, orientation, and assessment. You can study the global criteria for the first practice domain and relate it to the core functions mentioned here. This will make it easier for you to study for the LCDC exam review. You don't have to study twice. You only need to relate the 8 practice domains with the 12 core functions. The recommended readings for this topic are Tab 21, Addiction Counseling Competencies. It's a SAMHSA publication that you can get for free when you go to the SAMHSA website. And I also recommend the book Learning the Language of Addiction Counseling. In the next presentation, I will be talking about assessment, the second part for clinical evaluation. Thank you for watching this video. Don't forget to subscribe to the LCDC Exam Review channel. Like this video if you find it helpful, and thank you for watching.